the way that our system looks at, refers to, categorizes, and talks about friends, family, and neighbor care is a little bit disturbing. Well, it's a lot disturbing, actually. Parents of very young children across all income levels, cultural groups, across languages, across communities want caregivers who know and value their children and who share fundamental family customs and values and taking care of their children. And so there should not be a downside for relying on friends, family, and neighbor care. Many families that we work with here on the ground have reported resorting to friends, family, and neighbor care during this pandemic because they've lost formal childcare, so to speak. Their centers had to close their doors, their providers had to close down because of a lack of support. The people that we work with on the ground, the people that we hear from, the people who are suffering from these disparities, these inequities, the people who have lost their childcare programs, actually express how fortunate they have been to find a family child care provider with an intimate setting, with someone who actually cares and understands the customs and the values that their children cross that threshold with. So it's important. It is important. We have got to find a way to change the language that we've been using when we refer to friends, family, and neighbor care, because it matters. You know, I heard somebody say a couple of weeks ago that because their child was with grandma or with auntie during the day, that there was not learning going on, and that's not the case. That is not the case. So this is a kind of deficit language that I'm talking about that we hear out in the community. And there are all sorts of resources and techniques that we can support family, friends, and neighbor care with, because they're in the process of building brains as well. Just because they're not in a large childcare building, just because they're not in a K through 12 building, does not mean that they are not growing brains. Exactly. And this is where families are comfortable. And if we truly are talking about redesigning systems and meeting people where they are and building things with families and not for families, we have got to take into consideration that this is happening. It's a reality. It's proven to be good for so many of our children, and we've got to find a way to support that as well.